Cette conférence va maintenant être enregistrée.
Good morning, everyone. Welcome to World Kidney Cancer Day. And the theme this year is we need to talk about physical activity. And we have an expert with us, Dr. Linda Trinh, who will take us through the benefits of exercise, how to use the exercise guide for kidney cancer survivors. She is the co-author of that guide. And Alexis Whitehorn is also with us, who is going to do the demonstration of the exercises we will be talking about. So welcome to you, ladies, and I'll leave the floor to you.
Great, thank you, Mona. So again, welcome to World Kidney Cancer Day. And thank you to all of you for joining us this afternoon for a talk on physical activity. So I'll talk about how to use the guidebook that you can download for free on the Kidney Cancer Canada website. And I'd just like to acknowledge the International Kidney Cancer Coalition, who has put together this World Kidney Cancer Day along with all of its international affiliates, including Kidney Cancer Canada. So for those of you who have seen me before, you might recognize that I have given talks about physical activity in the past to kidney cancer patients and survivors. But for those of you who are new and haven't seen me before, my name is Linda Trinh, and I'm an assistant professor in the Faculty of Kinesiology and Physical Education at the University of Toronto. So my research area is in exercise and cancer survivorship. All right. So we know that maintaining a healthy lifestyle is a key component to many cancer prevention and survivorship recommendations. So you can see here from the World Cancer Research Fund and the American Institute for Cancer Research, there are a variety of cancer prevention recommendations that should be taken if you want to prevent cancer. So one is being a healthy weight, being physically active, having a healthy diet. And in your last session, you've attended a nutrition recommendation session, which talks all about healthy eating. And there are other recommendations such as limiting consumption of sugary and sweetened drinks, for example, alcohol. And after a cancer diagnosis, if you've been diagnosed with cancer, then you should continue following these recommendations if you can. So leading a healthy lifestyle is not only important for cancer prevention, it's also important for after a cancer diagnosis. Exercise is also important for cancer prevention and treatment. So for adults, exercise is important for the prevention and specifically lower risk of 7 common types of cancer. And this includes colon, breast, endometrial, kidney, bladder, esophageal, and stomach cancer. So there's strong evidence that exercise can prevent these 7 most common types of cancers. Exercise is also important for decreasing a number of treatment-related symptoms if you've been diagnosed with cancer, and that includes decreased fatigue, anxiety, and depression. So again, for cancer survivors, those who have been diagnosed with cancer, incorporating exercise is important for improving survival after a diagnosis of breast, colon, and prostate cancer. The evidence around survival and the other cancer types is still insufficient, but right now we have sufficient evidence for breast, colon, and prostate. Here I'm going to show you the specific benefits of exercise for kidney cancer survivors. So the work that we've done here in our lab, we looked at, what is the relationship between exercising and quality of life in kidney cancer survivors, specifically those who have been diagnosed with kidney cancer. You can see here on this graph, we looked at quality of life, and an indicator of quality of life is fatigue. So we know that about 80 to 90% of individuals undergoing treatment will experience cancer-related fatigue. And at the bottom here, you can see all the different types of physical activity. So there's a combined type, which is both aerobic activity and resistance training. And then you can see how, if they're compared to, if you do a combined program of both aerobic and resistance training, how that compares to doing none of these guidelines, or doing strength only, or doing aerobic only, and so forth. So in some of our earlier work that we've done, we actually showed that some exercise is better than nothing. So if you even do something as little as 10 minutes of physical activity, you can still experience benefits of reducing cancer-related fatigue. And here, I know it looks a little bit counterintuitive, but the higher the scores here, so the higher the bars, the lower fatigue that you have, the better quality of life, less fatigue. So you can see here that if you looked at the combined, so if you did a combined program of both aerobic and resistance training versus doing nothing at all, you actually have the greatest amount of quality of life, or you have higher quality of life, reduced fatigue. But if you did, let's say, what if you wanted to compare it to strength training only? So if you did a combined program of aerobic and strength training, you're going to see increases in quality of life over just doing strength training alone. And the same with aerobic activity as well. So in summary, what this graph indicates is that doing a combined program is better than doing no physical activity. It's better than strength only and aerobic only. But if you had to choose one or the other, this graph shows that aerobic is better than doing nothing at all. So if you only did aerobic activity. So explain a little bit more about how you can achieve these guidelines, what these guidelines look like in the next slide. So the many benefits of physical activity for cancer survivors have prompted a number of organizations to develop exercise guidelines specifically for cancer survivors. So you can see here there are documents for Cancer Care Ontario, American Cancer Society, even the Clinical Oncology Society of Australia. But recently, the American College of Sports Medicine updated their physical activity guidelines for cancer survivors. It's still largely the same in that you should achieve at least 150 minutes of moderate to vigorous physical activity a week, plus 2 days a week of strength training. But with what the difference is, or at least the updated guidelines, suggest that they're now symptom-led. So if you have specific symptoms, such as cancer-related fatigue, quality of life, physical function, or anxiety, there are specific doses of physical activity that you should engage in for better results. So the overall recommendation hasn't changed. You should still avoid inactivity. So try to move as much as possible, as much as you can tolerate. You should aim to achieve 150 minutes a week of aerobic exercise. And that's largely the same as the public health guidelines for the general population. But if you have specific symptoms, you can take a look at this chart here. And we now have strong evidence for a number of different outcomes. So cancer-related fatigue, if you wanted a exercise prescription of how to proceed, you would do 3 times a week of at least 30 minutes per session of moderate intensity exercise. And this should be supplemented by 2 times a week of resistance training, of strength training. And how long should you do this? Usually you would do it at least, there's better evidence if you did it for 12 weeks or longer. But the idea is to maintain a lifelong commitment to physical activity if you can. So how do we get started? So I talked a little bit about, what the benefits of physical activity is for cancer survivors, but how do we get started? The exercise guidebook is a great, a starting point. It is developed by funding from Kidney Cancer Research Network of Canada, as well as Kidney Cancer Canada. It's developed by myself and a number of my colleagues. And this is free to download on the Kidney Cancer website. It's available in English and French. And the whole premise around this guidebook is to try to create lifelong change in exercise habits. So you're going to achieve your exercise goals that is individualized and tailored to you. So there's a number of different activities in this guidebook so that you can create a personalized, tailored program that's meaningful for you. The intended audience is for kidney cancer survivors, so it's written for you specifically for those who've been diagnosed with kidney cancer, but it's also for your caregivers as well, because it's physical activity is important, not only for kidney cancer survivors, cancer survivors in general, but everyone, the general population, and other chronic diseases as well. It's also a resource for healthcare professionals and oncologists. Some of your oncologists may have pointed you towards this, the use of this guidebook, or they may have handed you a guidebook when you see them at their office. So it's really meant for a tool to get you started on a physical activity program. The guidebook is not meant to be read all in one sitting. It is about 118 pages, and we're not expecting that you're going to make a lifelong commitment to physical activity just in one day. It's meant to be read over a series of weeks and even months. There are activities within each of the sections that will help guide you towards how to reach a lifelong commitment to the program. So here you can see the various table of contents or the various topics in here. So, it has how you're going to get started, how does exercise benefit you, talks about, exercise intensity, how much should I be working on, what should I wear, how do we make exercise fun? And it really takes you through a lot of common topics that you would encounter, or at least barriers that you would encounter in starting an exercise program. And it also, within each of the sections, they have activities that for you to write down. So what are the benefits of exercise that are most important to you? Exercise is only going to be meaningful and something you find fun and enjoyable if you see the benefits being important to you. So how do you achieve the recommendations? So we know that, yes, you have to achieve about 150 minutes of moderate intensity exercise per week. So how do you achieve that? You can do that by doing 30 minutes every day for 5 days a week, or you can do 50 minutes for 3 times a week. But you don't have to do it all at once. So we know that 30 minutes for someone starting out with exercise could be difficult, but you can break it up into different chunks throughout the day. So if you did 10-minute chunks in the morning, and then 10 minutes at lunch, and then 10 minutes in the evening, you have 30 minutes of exercise. That counts as well. You can accumulate any amount of time throughout the day. So you don't have to do all that 30 minutes all at once. Just do what you can. So you can even do a couple minutes in the morning. If you have more time in the evening, you can do the rest of your activity there. So the idea is not to do 30 minutes all at once. If you cannot, you can break it up into chunks. So that's how you would achieve the recommendations. And what type of activities should you do? So what are the meaningful activities? What counts as moderate? What counts as vigorous? I know this is a question that comes up a lot. How do I know what the intensity of exercise that I'm doing? So moderate intensity exercise, it makes you breathe harder without feeling out of breath. Think of it as if you could still carry out a conversation, but you can't sing. A good example I like to use when talking about moderate intensity exercise is think of yourself as being late for an appointment. If you were late for an appointment, how quickly would you walk? And that's exactly what moderate intensity is like. It's walking quickly as if you were late for an appointment. It could be easy bicycling, easy swimming, golfing, canoeing, and dancing. Those are types of moderate activities that you can engage in. For those of you who are ready to do vigorous intensity exercises or want a little bit of a challenge, you can do that as well. So for vigorous activity, you don't have to do 150 minutes. You can do just 75 minutes a week. So those are the guidelines: 150 minutes moderate activity or 75 minutes of vigorous intensity. So the breathing in vigorous intensity exercises are rapid and deep. So you can't say more than a few words without pausing for a breath. So these are examples such as jogging, running, aerobic class through videos, cross-country skiing, vigorous swimming, vigorous bicycling, and skating. Those are all examples of what vigorous intensity exercises are. Strength training is anything you can do with dumbbells. It could be chair sit to stand. The session today, the last half hour of this presentation will be all about engaging in strength training or a home-based workout you can do, and Alexis will demonstrate some of the different things you can do at home to improve your strength. So the activities that you choose, remember, it's up to you. What I always like to say is choose an activity that is fun and enjoyable. If it's fun and enjoyable, you're likely going to stick to it. If you find it to be boring, don't choose it. If you prefer to do something else that will get your heart rate moving, increasing, and get yourself moving, again, choose something that's fun and enjoyable. Most cancer survivors actually prefer walking as their modality of exercise. So if you wanted to choose just do walking, that is fine as well. So this is an example of some of the activity preferences that you can engage in. So here it's a one activity in the guidebook that suggests that you can fill out all of the different activities here. So what you prefer to do. So you will write down the 5 favorite types of exercises here. And this, I won't go into this in much detail because the guidebook actually goes through all of these activities. One of the things that's really important is to set SMART goals. So setting goals that are specific, measurable, attainable, and realistic and timely. So this gives you a sense of direction and purpose and motivation when working towards change. So you want to build in short-term goals. So these are your near future or goals that you can achieve within a few weeks or months. And these are building blocks for your longer-term goals. So longer-term goals are between 3 months to 1 year or longer. And the guidebook actually goes through how to set SMART goals and how to plan for physical activity. And this is an example of a walking goal in the guidebook. It says starting on Monday, I'm going to walk for 15 minutes, 3 days this week, Monday, Wednesday, and Friday. I'm going to ask my coworker to see if I will walk, she will walk with me at lunchtime. Eventually, I would like to be able to walk 30 minutes, 5 days a week, Monday to Friday. If I can do this for 2 weeks, I will reward myself by going out to a dinner at my favorite restaurant. You can see that this was written prior to the COVID-19 pandemic, so this will have to be a bit modified given the current regional restrictions. But here you can see that there's a short-term goal that's very specific in indicating when, which days of the week this person will be active. And then it actually goes through and says, what the long-term goals are. So here it's an activity. It takes you through how to create these goals. So I encourage you to take a look at that. And we know that, starting an exercise program isn't easy. There are a number of barriers that you might encounter during your exercise program, and that is okay. That's perfectly normal, and that's something that you will revisit. But what's really great about this guidebook is that it talks about the most common barriers to exercise and ideas and strategies on how to overcome them. So one of the main barriers, or the most common barriers to exercise that kidney cancer survivors have indicated, is that they have no time. So that's the number one reason. So if you have no time, you're finding yourself strapped for time, you want to exercise first thing in the morning, use exercise as transportation, or exercise for longer durations during the weekends to get that time in. You want to schedule your workout in your agenda as if it was an appointment. That really helps as well. So if you have to work during the day, you try to be active during the lunch hour, or you start walking to work, or getting a few stops off early from a bus stop. If you're too tired, so that's another common barrier. If you're too tired from treatment or you're experiencing cancer-related fatigue, exercise can actually be beneficial. Something as little as 10 minutes a day can actually improve your fatigue levels. You're going to feel less tired. So you want to exercise on days and during times when your fatigue is at the lowest, especially if you've a long-time survivor and you know the days in which you will feel most fatigued. You want to try to exercise around those days. You can still, you don't have to do moderate intensity to vigorous intensity during those days where you feel really fatigued. You can engage in light physical activity as well. The idea is to avoid any inactivity. So even going for a light physical activity is better than doing nothing. So you want to accumulate exercise in any amount throughout the day. So if you had other medical and health issues, that's another barrier. You want to exercise at a level you can tolerate and choose low impact activities. And again, accumulating activity in any amount throughout the day. If it's too hot or too cold, some of the ideas is that to be active in the middle of the day when the weather is warmest, and later in the day when it's the coolest. So if it's really hot outside like today, you might want to consider, if there's an indoor space where you can properly socially distance. Mall walking is a great alternative because it's air conditioned. If you don't have a gym where you live, that's an excellent question and an excellent barrier, because if you don't have a gym where you live, you should choose, there are a variety of different activities you can choose with very minimal equipment, such as walking. You can walk outside in the parks, on the trails. You can consider buying a bike or a treadmill at home. But later on in the session, you'll see that you don't actually need that much equipment. You can use everything that you have at home for a home-based workout, and we'll show you how to do that. So this is a plan for physical activity. If you, let's say you want to set up a plan for how to achieve 150 minutes of exercise, this is a great activity to do, and it's in your guidebook as well. So you can see this person is going to, on Monday, going to walk for 30 minutes in total, but they're breaking it up. They're doing 5 minutes in the morning, 10 minutes in lunch, and 15 minutes in the evening. And then they're going to do 30 minutes on Friday and then 30 minutes on Sunday for a total of 90 minutes. And this person decided that, I'm going to go swimming as well for 60 minutes. So 60 minutes, and then they're going to engage in strength training 2 days a week. So you can see here that the days they've chosen are Tuesdays and Thursdays. So having a plan for when you will be doing physical activity will be helpful for you to stick to your goals and actually stick to the program. And you can see here, once you add that up, it's 150 minutes plus 2 days of strength training. And it's also important to indicate where exactly you're going to do this activity so that you have a plan in action. And then if you plan to be active with any other individuals. Building a supportive environment is also important for reaching your exercise goals. Friends and your family and your spouse can serve as helpful reminders to get you motivated to maintain your exercise program. Even if they don't exercise with you, they can be a friendly reminder or prompt you to do your exercise throughout the day. You can do active outings with your entire household. You can also do a buddy system to be accountable or an online exercise class. So some of these safety considerations when you're starting an exercise program, consult your doctor before beginning any exercise program, just to receive proper medical clearance. You want to practice social distancing guidelines in your region. And you want to stop exercising if you notice any of these unusual symptoms. So these are things like leg pain, chest pain, dizziness, shortness of breath. If you're undergoing treatment during the day, or you want to exercise as much as tolerated. So just do what you can for that day. And if you decide that, during treatment or during your treatment day that you cannot exercise, maybe resume it the following day or the day after once you're feeling better. So you want to also stay hydrated as well when you're exercising. So what are the take-home messages? Just to close up this section of the webinar. Download the guidebook to get your physical activity journey started. Physical activity is safe and tolerable for most cancer survivors, even during treatment and even for kidney cancer survivors. Try to achieve 150 minutes of moderate intensity exercise per week and at least 2 days of resistance training per week. Remember to select an activity that is fun and enjoyable. Make a plan for your exercise based on your goal and anticipate your barriers and some of the strategies to overcome them. And the guidebook provides you with a number of different tips to overcome the most common barriers that kidney cancer survivors have indicated that were barriers to them starting an exercise program. If you're interested in research studies, we here at the Exercise Oncology Lab, we have a number of exercise studies going on. And we're looking for kidney cancer survivors to participate. So I've provided my email here. So if you have any questions about this particular webinar or exercise in general, or just interested in participating in research studies, we can definitely pass along some more information for you. So my email address is below here, and I'm sure Mona can send that along. So now we're going to move on to our home-based exercise session. So let's get active. So this physical activity webinar wouldn't be complete without an actual exercise program. So this will be led by Alexis Whitehorn. She is a graduate student at the University of Toronto, and I've worked with her for a number of years when she was an undergraduate student, and now she's a master's student. She's also a certified personal trainer, and she has years of experience working with healthy and chronic disease populations across the lifespan, including cancer survivors. So I want to highlight the equipment that you might need for this session and give you a few minutes to gather that while Alexis gets ready to demonstrate some of these exercises. So all of this can be done in the comfort of your own home. You'll just need a wall, a chair, 2 weights. If you have dumbbells at home, you can choose anywhere between 1 to 8 pounds. For beginners, we recommend 1 to 2 pounds, but if you don't have dumbbells, that's okay. You can, gather some common household items. This can be water bottles, soup cans, a filled grocery bag, or a bottle of laundry detergent. So just anything that you can comfortably grip would be fine as well. So I'm going to turn it over to Alexis Whitehorn, and she will finish the rest of the session by getting you all active. Thank you.
Thank you, Linda. That was great. I think one of the main message that I learned from this is that you don't have to do in one go all of your exercises. And sometimes we do have 10 minutes, and I think you've shown that the 10 minutes is better than nothing at all to do an exercise.
Yeah, so I would say just even accumulate as many minutes as you can. throughout the day. You don't have to do it all at once, a few minutes here, a few minutes there, as long as you have your set duration for what you want to achieve throughout for the day. So let's say you're interested in doing 30 minutes, just break it up as you go along. Or if you want, you can do it 30 minutes all at once. It's up to you, but do whatever's comfortable and what you enjoy.
Okay, thank you. Okay, I'm going to stop the sharing of the screen so that we can get to there. So Alexis, you can start at any time.
Okay, well, thank you so much, Linda, for your presentation. I am going to do the exercise portion. So for this, you do just need the minimal amount of exercise equipment. So today what I'm going to be using is a wall, a chair, and then some light pound weights. So sorry in advance if my head does get a little bit cut off, but I'm going to demonstrate this the best that I can. So for this, we are actually going to start off with a warm-up. So a warm-up is very important because you want to get your muscles basically warmed up. You want to get your blood flowing and your heartbeat pumping. So another way I like to think of this or explain to my clients is that, say for instance, you have an elastic rubber band. If you stretch a rubber band when it's cold, what happens is that band breaks. So the same thing with your muscles. If you're doing exercise and not properly warming up, you are creating or highering your risk of injury. So you want to warm up to prevent that risk of injury. To warm up, we're going to start with core. So your core is very important because you use this in your daily activities. So this can be simple activities such as walking, your posture, you use your core muscles, or even like going in a cabinet, grabbing or making food, you're always using your core muscles. So to begin this first warm up, we are going to do a pelvis retroversion. You're going to need the wall for this. And then you want to start with having your feet about 5 inches away from the wall. So the closer your feet are away from you, the harder the exercise is, and the more your feet are underneath you, the easier it is. So you start with your feet shoulder width apart. You want to have your behind on the wall and as well as your shoulders. If you actually take one of your hands and place it behind your back, you will notice there's like a little negative or empty space. You don't want this to happen. And so to engage your core muscles, you actually want to rotate your pelvis so that you do not have any space between your back. For this warm up, we're going to start by doing 10 seconds, and then we're going to take a 10-second rest. We're going to do 3 sets of these totals. So you want to start, have your shoulders against the wall, and then slowly rotate your pelvis. So you should start to feel your abs contracting. Another way to think about this is imagine that you have like a pair of sunglasses or glasses in general, and you're trying to clear them or defrost them, and you're doing that breath motion, such as you feel your abs contracting. So that's how you want to keep your core the entire time throughout this entire exercise and warm up. So we're going to start by doing the 10 seconds on. I'll count it down. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Take a 10-second rest. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. And then once again, we're going to do that same position. Make sure there's no negative space or any empty space between your back, and contract for 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Rest again for 10 more seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. We're going to do that last set. Make sure your shoulders are touching the wall. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Great. So we're going to move on to the next warm up, which is a lateral step touch. And then for this, you just want to have fun with it. We will be doing 2 sets of this. So you want to make sure that you're in a space, that you have enough space to just move around. And if you ever feel like you're losing balance or experience any unusual signs, such as what Linda mentioned earlier in the presentation, you can stop or you can take a rest break in between wherever needed. So we're actually going to do 2 sets of these. So you're going to first start by just stepping side to side. And this is called a lateral step touch. We're going to do this for 30 seconds so you can actually follow along if you're at home doing it with me. So we're just going side to side. And then you can have fun with this. If you have music, feel free to play music, whatever keeps you motivated and going. You also want to make sure that you're going at a comfortable pace, that you're able to complete the full motion for the full 30 seconds. Or you can either go slow the first time or even speed up or take it at whatever speed is most comfortable for you. And the 30 seconds are up. So next we're going to do a lateral butt kick. So it's going to be the same motion. However, this time you're actually going to try to reach and kick your butt as fast as possible. So I'm going to demonstrate it. And you can put your hands on your hips. So we're going to do this for 30 seconds. And if you want to challenge yourself, you can go faster, or you can start slow and slowly start to increase the speed, but just go at a pace that's comfortable for you. And you can have fun with this. Keep going, almost there. And next we're going to do high knees. So this is the third exercise for this first set of warm-ups. For high knees, you want to reach, you're going to stand on one knee and try to reach as high as possible. So again, if you need to use a chair or the wall for balance, please feel free to do so. And then you can switch up the variation. You can go as slow or as fast as you want to go. We're going to do this for 30 seconds. And if you want to challenge yourself, you can add a little bit more faster pace. Keep going, keep pushing yourself. Great. So we're going to actually do that for a second time. This time I'm just going to actually make it a little bit more challenging for you. So we're going to start back with that lateral step touch, but this time we're going to add a little bit hand motion. So it's going to be like almost like you're dancing. So we're going to do this for 30 seconds. And again, have fun with this. You're doing this at home, trying to stay fit, motivated. You can play some music in the background if you need to. Great, and then we're gonna do that butt kick, but this time instead of moving your arms forward, you're gonna bring your arms to the side. So 30 seconds again. Great. Are you guys able to still see me and hear me?
Yes, we can.
Okay, because my
Okay.
connection lost for a
All right.
second. Okay. Now we're gonna do that high knee, but this time we're actually going to reach up. So same thing, 30 seconds. So high knee and reach up. And you could do one arm at a time if you want to. And if you're noticing that this movement is too hard, you can modify it. Do it at a range of motion that's most easy for you. Great. Now we're going to move over to 3 more warm-up exercises. So now that your blood is all pumping and flowing, we're going to do more stretches, but it's more relaxed. So this one, we're actually going to do some shoulder rotations. For this, you want to make sure that your neck and your head is straight. You don't want your neck to be protruding out too much. So you're going to stand straight and just slowly roll your shoulders. We're going to start forward for 15 seconds and then roll back for 15 more seconds. Try to reach your shoulders to your ear. So roll. Make sure you're breathing too throughout the stretch. Take nice deep breaths. And then roll backwards. And again, make sure you're activating those core muscles that we worked on to begin with. Next, we're going to do a neck roll. So the same thing, have a nice tall posture. Your head should be straight. If you do notice that you're getting like a slight double chin, that's normal. That's how we want you to stand, so you're in a good position. For this, you're just slowly rolling your head side to side. And if this motion is too difficult or you're noticing that you're experiencing pain, feel free to stop or just modify that neck roll. So go to a distance that's most comfortable for you. So we're gonna do 30 seconds for this. So you should feel those neck muscles opening up. And remember, this is just a warm up, not the exercise. So try to relax yourself. Great. And then the last warm up for this set is a leg swing. So this exercise or stretch, you want to make sure you have enough space so you're able to get the full range of motion in your legs. So we're gonna do 30 seconds per side. And you're just kicking that leg back and forth as high as possible. So I'm gonna start the timer. So for this one, you can even slowly do kicks and then ease up. You want to stand next to the wall for balance. And try to keep that opposite leg as straight as possible. We're gonna do the same thing to the other side. 30 seconds. So go at a comfortable height. And the more you do this, the easier it is and the better range of motion you actually gain over time. Great. Now we're just gonna do that warm up one more time and we'll start the exercise. So we're gonna go back to that shoulder rotation, 30 seconds. So forward 15 seconds. Try to reach those shoulders to your ears Get a nice stretch in the shoulders. Make sure you're breathing. Then we're gonna rotate backwards. Really try to open up those shoulder blades. Great. Now we're gonna do our neck rolls. So I'm gonna start the timer, 30 seconds. Go side to side. Really try to push yourself a little bit further this time. Few more seconds, keep going. Great. And our last leg swing. 30 seconds on the timer. So really try to get that leg up higher if you can this time. It's our last warm-up stretch before the exercise. Great. Switch sides. Last 30 seconds. Keep pushing, halfway there. Great. So you made it through the warm-up. Now we're gonna begin the exercise portion. So for the exercise portion, the first exercise we're gonna do is a squat. So the equipment needed is just the wall and your chair. For a squat, make sure your chair is in a non-slip environment and it's also against the wall so it doesn't move while you're doing the squats. To begin, you start with your feet, shoulder width apart. Your arms are going to be crossed at, you can see, your arms are going to be crossed at your chest. And then you're just going to do a full stand and slightly tap the chair and stand back up. So the key to this is not sitting all the way down, but you want to keep that momentum going by doing a slight tap and standing back up. If this is too difficult, feel free to sit down comfortably, hold and rest for like a second or two, and stand back up. We're going to do this for 45 seconds. So get ready and go. And we're only doing one set of this, so really try to push yourself. Make sure you're getting the full motion throughout the hips, squeezing the glutes as you stand. You might feel a slight burn in the quads, but that's what you want. This is a normal response to exercise. Make sure you're breathing, taking those deep breaths. So breathe in, breathe out, breathe in, breathe out. Keep going. Great. Next, we are going to do bicep curls. So same thing, since you already have your chair set up, the next thing you would need are your weights. So if you are a beginner, it's encouraged to use lighter weights such as 1 to 2 pounds, or you can use household items. This could be like a can of soup, maybe even like laundry detergent, bag of flour, whatever you can find at home. So you want to sit all the way in the chair, good posture, make sure your abs are recruited the entire time, and both arms at the side. Keep your elbows tucked in, or another way to think about this is keep your elbows close, that you imagine there's a piece of Velcro sticking to your elbow and torso, and it doesn't allow your elbow to move. This is how you want to keep your arms the entire time. Whenever you're ready, you're actually going to slowly rotate the wrist and the weight up and do a full arm curl and back down. Do this as many times as possible. We're going to do this for 45 seconds, so I'm going to start the timer. And go. So really try to recruit those bicep muscles. Make sure you're breathing. If you need a break in between, feel free to take that break. Really try to push yourself since we're only doing one set. And time. Great. So the next exercise, we are actually going to do a wall sit. So we're actually just going to limit this to 30 seconds due to the time. But for wall sit, the posture you want to have is your feet are shoulder width apart, and the lower your body is towards the ground, the harder it is. So the more your legs are angled at a 90-degree angle, the more you feel your leg muscles start to burn and your core starts to burn. So remember how we practiced in the warm-up, that pelvic rotation? You want to have that same pelvic rotation that you did in the warm-up. You shouldn't have any space between your back and the wall. So we're going to do this, hold this for 30 seconds. Have a nice good posture. And remember to breathe. So with core, we typically forget to breathe because we're so focused on contracting our abs, but make sure you're breathing throughout the exercise. So take nice deep breaths. Try to breathe in, breathe out, breathe in, breathe out, and time. Next, we are going to do a plank. So this is using the same muscles, your core muscles. For this position, you want to keep your elbows on the wall and your body straight. You really want to try to use your core for this exercise and don't let your back kind of flatten in or curve in. If this is too difficult, stand closer to the wall and it's easier. So the more your feet are away from you, the harder it is. So we're just going to do this for 30 seconds. Really try to breathe. Great. And then we only have 2 more exercises, and I promise we're almost done. Or we have 1 more exercise, actually. We're going to do a push-up. So you're going to be in the same position, except instead of your elbows being on the wall, your hands are on the wall. So same thing, you really want to recruit those core muscles to keep your body straight. You want to do this push-ups as many times as possible within the 30 seconds. The goal of this is to actually be completely parallel with the ground, but we're going to start off easier and use a modified version that is just as hard. So we're going to do this for 30 seconds. Really try to keep your body straight, making sure you're breathing. Keep pushing yourself. You're halfway there. Almost done. And time. Great. So that actually concludes the strength portion. So the last thing that we're going to do is our cool down and our last final stretches. So the first stretch is the shoulder and chest stretch. You want to place your palm on the wall, but make sure your thumb is pointing up towards the ceiling. You're going to take your body, place it towards the wall, and slightly angle your body. You should feel a stretch in that shoulder chest area. So we're going to hold this for about 15 seconds. Great. Now switch to the other arm. Same thing. Thumb up. Slightly rotate your body. Hold this for 15 seconds. Five more seconds. And really try to breathe and try to let your heartbeat go down. Next, we're going to do the quad stretch. For this, you can just use the chair or the wall. We're going to take one leg and hold that stretch. We're going to hold this for 15 seconds. And if you're finding the stretches too hard to perform, if you actually take a sheet or an elastic band and wrap it around your ankle and pull it, you'll feel that stretch as well. Great. So we're going to switch to the other foot. Same thing, you can hold on to the chair for balance, 15 seconds. Almost there, a couple more seconds. Great. And now we're going to do a hamstring stretch. So for this, you need two chairs or a coffee table or just something that you're able to rest your foot on. So for this, you want to just slightly put your foot up, try to point your toe up towards the ceiling or towards you as best as possible. Have a nice, good posture and reach forward. So try not to let your back curve. You want to keep your back as straight as possible. We're going to hold this for 15 seconds. And you should feel the stretch behind the leg. You can try to touch your toes or reach for your toes if you want to. But make sure you're not overexerting or over pulling that muscle. Great. Now we're going to switch to the other side and do the same exact thing. And our final stretch. For our final stretch, it's a scaling stretch. You want to sit in your chair and place one hand underneath your bottom. It's kind of hard to show, but place one hand underneath your bottom. Have a nice tall posture and slowly reach the opposite ear of that hand over. Keep going until you feel a nice stretch, and we're going to hold this for 15 seconds. Great, and we're going to do our last side, the last 15 seconds. And that is it. So good job if you're able to follow along and keep up with the exercise. I don't know about you, but I'm pretty worked up and feeling pretty good to go.
Thank you, Alexis. That was great. Great timing. 3 on the dot. Huh? That was a good workout. That I was watching mostly, but I didn't join in, but it was a good workout. And depending on the intensity as well. I think what I liked about this is that we weren't really going by, an objective of numbers, but an objective of time, of how much you could do within a period of a few seconds, which I thought was very helpful.
Yeah.
All right. So thank you, Linda, for everything.
Thank you.
I have no questions. Nobody asked any questions. So this session is recorded. So we will be putting it up on the website. So thank you so much for participating in this. I can't thank you enough on that.
Right. Thank you, Mona. Thank you, Alexis.
Right.
And thank you to all of you for joining today. All right. Bye, everyone.
Thank you. Goodbye.